Honourable Premier has the call.
Thank you very much, Mr. Speaker. Let me thank the official opposition and all members for having returned back to do the work of the people, the business of Alberta here in this Legislative Assembly. I believe we'll be the first legislature in Canada and one of the first in North America to return to doing the people's business in a way that is fully compliant with public health orders during this peculiar time. And I want to thank in particular the official opposition for their constructiveness in working with the government House Leader in arranging for this session, and particularly today's very important update and opportunity for questions on the response of Alberta to the COVID-19 pandemic, both the public health and the economic crisis that are a consequence of it. Mr. Speaker, let me begin by expressing my condolences, and I know that of all members, to the families and friends of those who have passed away in Alberta as a result of this pandemic. Some 139 Albertans that we know of whose lives have been taken by this virus as of yesterday afternoon. Mr. Speaker, I will offer a report on Alberta's response, which has been remarkably strong. And for that, I credit the people of Alberta and their ethic of personal responsibility and compassion for others. We, as a province, have managed to implement some of the least restrictive public health orders in the Western world, certainly amongst the least restrictive in Canada, and yet have had far stronger results than other large population jurisdictions in combating the spread of COVID-19. As of yesterday, we have tested over the past 11 weeks some 6,900 total positive cases on 243,000 tests. That is to say, about 2.8% of those who've been tested for COVID-19 tested positive. To date, 6,048 of those 6,900 cases have since recovered, and so about 88% of those who tested positive have happily recovered. I should note that in more recent days, Mr. Speaker, as we see the number of new cases continue to come down, the number of recoveries continue to go up, we continue to maintain high levels of testing, and the percentage of those testing positive has come down as well, which is a very encouraging metric. And I see that in recent days, we've been averaging about 0.6% of COVID tests in Alberta coming back positive. And so these are all important indicators that we have succeeded in flattening the curve and reducing the spread. Congratulations to Albertans for this important achievement. There are currently about 669 active cases with 45 Albertans in acute care beds with COVID-19 and 5 in intensive care. And that, of course, is a very important metric, because what we all understand, even as lay people, about the epidemiology of a influenza of this nature is that it is virtually impossible to completely eradicate the spread or its potential spread. But what is critical is that it not be permitted to overwhelm the healthcare system. And I commend our administrators and healthcare personnel for having worked with alacrity to expand the total capacity of the healthcare system over the past months to a point where at its peak we had nearly 2,800 acute care hospital beds set aside for COVID-19 patients. That has since come down to 1,000 acute care beds set aside for COVID-19 patients as we have begun through the relaunch to reallocate some of the dormant beds back to conventional acute care for non-COVID related maladies. The first reported case in Alberta was March the 5th, and of course positive cases rose steadily until peaking at nearly 350 on April 23rd, which turns out to have been the peak in Alberta, at least to date. It has been declining steadily ever since, and yesterday total new positive cases were only 22 on about 3,000 tests. These numbers, as I say, highlight one of the most successful fights against the pandemic in the Western world. We set out to flatten the curve, and Albertans did it. This is also a tribute to civil society groups and individuals who stepped up to help and protect the most vulnerable, to donate goods and services, and of course to frontline healthcare workers and all who keep working to provide essential supplies and services. Happily, Mr. Speaker, through much of the last 10 weeks, we have had, as I've said, on average, we've been operating with about 2,300 COVID-19 designated acute care beds. And I think we peaked at just over 100 of those that were occupied by COVID patients. Through most of this period, we have seen well over 2,000 empty acute care beds in our hospitals and 200 empty ICU beds that have been set aside for COVID-19 patients. That's what I call a good problem to have. And I think currently we have 3 COVID-19 patients using ventilators. Of course, many of us were most concerned 2 months ago looking at the situation in northern Italy, in New York, in Madrid, about the potential of running out of ventilator capacity. Again, credit to our officials both for having surged orders for ventilators as early as late 2019, and for having repurposed ventilators in the system here from charter surgical facilities, from SAIT and NAIT, for example. And so we were averaging about 250 extra capacity of ventilators over much of the past several weeks. I would also like once again to pay tribute to Alberta Health Services, in particular Jitendra Prasad, the Director of Procurement for AHS, who did a brilliant job of beginning large-scale ordering of relevant PPE, personal protective equipment, on the first rumors of an influenza-like flu emanating from Hubei, China, in December of last year. And partly as a result of that, and the long-term relationships with suppliers established by Alberta, we have done better than any Canadian province and better than I think virtually any jurisdiction in the world in terms of being prepared with medical equipment. Currently, I can report to the Assembly that we have 462,000 N95 masks available, which constitutes 78 days of inventory. We have 31.7 million procedural masks, constituting 117 days at the current burn rate, 33.6 million surgical gloves, representing a 44-day inventory at the current burn rate, 3.77 million face shields for 624 days of burn rate, 4.6 million gowns representing 234 days of inventory, 327,000 goggles representing 148 days of inventory. And I should add that for all of those categories of PPE, we have enormous orders that are waiting to be fulfilled. And so, in fact, we expect that those inventories will only increase, which I believe validates our decision last month to have shared some of our surplus equipment with our fellow Canadians, particularly in British Columbia, Northwest Territories, Quebec and Ontario, as well as, I believe, Nova Scotia, because they were facing a much steeper curve, higher infections, hospitalizations, and were less well equipped. I am happy to inform the Assembly that the government also has ordered 40 million non-surgical masks for our program to make those available to members of the general public as we move into relaunch, and we have already received 20 million of those. Next week we will be announcing the distribution program. As I've said, Mr. Speaker, one of the best measures of our preparedness and the efficacy of our pandemic response is the utilization rates of COVID beds and ICUs. As I've said, we now have, as of May 26, 1,000 dedicated beds in acute care. The current utilization rate is 4%, and 200 dedicated ICU beds, a current utilization of 2.5%. We continue to lead the world in testing, Mr. Speaker. Currently, our current per capita testing rate is 536 tests per 10,000 people. That's over twice as high as our neighbours in British Columbia and 25% higher than the next highest province of Quebec. And so quite consistently amongst large population jurisdictions, we have led the world. We've certainly led North America in terms of the incidence of testing, and we have since the very beginning, which is one of the reasons for Alberta containing this spread, because when the first cases arrived, we were able to surge testing, in part because of pre-ordering of reagent swabs and the preparedness of Alberta Precision Laboratories. As a result, that facilitated our aggressive tracing and tracking protocols very early on. So we were able to contain the initial cases in a way that many other jurisdictions could not. In terms of hospitalization rates, I'm pleased to report that through most of the past 10 weeks, Alberta has had the lowest per capita rates of hospitalization and ICU admissions, as well as mortalities amongst the large population provinces. In Canada, right now, we're tied essentially with British Columbia in that respect. But we are far lower in terms of our rates of hospitalization, ICU admissions, and deaths than, for example, virtually every large population jurisdiction across the Western world. To put that in perspective, Alberta COVID-19 related fatalities per 100,000 is just over 3, compared to 10 in Germany, 30 in the United States, 39 in Sweden. And I pause to say, to some members of the public who say we should simply emulate Sweden, they must be prepared to defend a death rate 12 times higher per capita than what we've experienced in Alberta. 40 per 100,000 deaths in France, 55 in the United Kingdom, which for the first stage in this crisis followed effectively the Swedish model, 57 deaths per 100,000 in Spain, 54 in Italy, and 81 in Belgium. And Mr. Speaker, I just offer those troubling statistics to set some context for how well Albertans have done, but also for how deadly this virus can be, because I know some of our fellow Albertans are saying, well, you've just overreacted with your public health measures. Why did you bother doing this? We hardly have anybody in hospital. The truth is, we just need to look at other very advanced, sophisticated, developed countries with first-rate medical systems to see how hard they have been hit and the extent of the loss of life. And Mr. Speaker, we did this, as I've said, with far less stringent public health measures. For example, we estimate, Economic Development, Trade and Tourism estimates that 85% of Alberta businesses were able to continue to operate, obviously within our hygiene protocols, over the past 10 weeks. The public health orders required the suspension of about 15% of businesses, representing 12% of workforce and 4% of our provincial GDP. Now, that is not for a moment to minimize the terrible impact on those business operators and their employees. And our heart goes out to them. And we thank them for the sacrifices that we made. And we understand and empathize with their profound frustration. But I simply offer Albertans this context, Mr. Speaker. Other jurisdictions, we did not have a lockdown in Alberta. We have not had. We are not locked down. We have not locked down. The only people that we required to stay at home voluntarily, some jurisdictions in Asia, if you get sick, they literally lock you up, Mr. Speaker, in a total quarantine situation. Here, we've asked people to stay home if they're sick, if they've tested positive, or if they've recently returned from travel. That's well less than 5% of the population. Yes, we recommended that people work from home if they could, and obviously follow the social distancing recommendations and so on. But by way of comparison, provinces of Quebec and Ontario, for example, completely suspended their manufacturing and construction sectors, and yet have had much higher levels of infection and fatalities than Alberta, which allowed those sectors to continue operating. And I simply say this, in this very challenging time, where every jurisdiction around the world has been trying on the best scientific advice to find the right balance to flatten the curve, to limit the spread, to save lives, without unduly affecting the social and economic health of our societies. And I know that every one of those jurisdictions will look back when this is over and see that in some areas they went perhaps too far, in other areas perhaps they did not go far enough. Every jurisdiction and the whole world collectively will have many lessons to learn. But I believe fundamentally here in Alberta, what we have achieved to date is something to be proud of as Albertans in how they have conducted themselves. Here's the point. The limited spread here with lighter restrictions is evidence fundamentally of one important thing, that Albertans did this voluntarily through their personal responsibility. They did not need in every aspect of their social and economic lives to be micromanaged by government. They did this by listening to the advice of our Chief Medical Officer, by employing good old-fashioned Alberta common sense, by caring for the vulnerable. And I think that is remarkable and commendable. Within the Western countries, I mean, Asian jurisdictions are a different category, really, because many of them immediately imposed border lockdowns from hotspots like Hubei in December and January. So they avoided those, and they've taken much more aggressive, targeted measures, which I think in many ways we must emulate, and I'll get to that later. But in the Western countries, and I should also say in the developing world, again, a different situation because very low levels of testing are not indicative of what the real spread has been in many developing countries. In addition, many of them are in a summer season where influenzas spread with less virulence. But amongst the let's say the northern developed countries, I believe, Mr. Speaker, the exception of Sweden, which has had strict public health orders in place, limit of 50 people that could gather, shutting down bars, high schools, colleges, and so forth. With the exception of Sweden and perhaps some Midwest U.S. states, we have had the least restrictive public health measures in place. Mr. Speaker, Alberta is now amongst the first provinces to move into relaunch. Our strategy began at the beginning of May with reopening of parks and golf courses, resumption of some scheduled surgeries and services provided by health professionals. Minister of Health announced other measures in this respect last Friday. On May 14, retail businesses and hospitality businesses, farmer markets, museums, art galleries, more surgeries and health services, places of worship, daycares, out-of-school care, day camps, more flexibility for post-secondary education began. On May 25th, Stage 1 was implemented fully in Calgary and Brooks, epicenters, which had become epicenters of the pandemic in Alberta. And I regret for the citizens of Calgary and Brooks that things were delayed. And I regret that confirmation was given at the last minute. But that is when we received the advice from our public health officials. And we were not going to ignore the advice, Mr. Speaker, that we received. 85% of confirmed cases at that point were and continue to be in Calgary and Brooks. And our public health officials quite rightly wanted a few more days to monitor new cases and identify their sources, and I'm pleased to see the numbers have continued to move in the right direction. As of May 15th, 77,000 Albertans are waiting for surgery because obviously this has had impact on non-COVID related health issues. 46,000 are waiting longer than clinically recommended, and so that is why it's important that we move forward with rescheduling surgeries as we are doing. Mr. Speaker, it is critical as we move forward that we focus our efforts on the most vulnerable, on the elderly and the immunocompromised. The average age of death from COVID in Alberta is 83. And I remind the House that the average life expectancy in the province is age 82. And so in Canada, 95% of fatalities are from COVID are for those over the age of 60. 80% are in care facilities. And the risk of death from COVID for people under the age of 65 is 0.0006%. We are learning more about this disease as we go through it. And what we are learning is that younger people, while not completely immune, have a rate of mortality related to COVID that is no higher than their general mortality rate for other illnesses. And so for most Albertans, the risk of death from other pathogens, accidents, and traffic fatalities is actually higher than it is from COVID. There will be more infections, there will be more outbreaks, there will be clusters, there will be more hospitalizations, and sadly, there will be more COVID-related deaths. But as we learn more about this, Mr. Speaker, I challenge our public health experts and our officials to ensure that our policy response is predicated on protecting the most vulnerable in the strongest and most discreet ways possible. Because we cannot continue indefinitely to impair the social and economic, as well as the mental health and physiological health of the broader population for potentially a year through measures for a influenza that does not generally threaten life, apart from the most elderly, the immunocompromised, and those with comorbidities. Mr. Speaker, we can now proceed to the next stages of the relaunch with strong confidence and bold action to assure a rapid and robust economic recovery. As the C.D. Howe report this week by leading economists and including David Dodge, former governor of the Bank of Canada, said, quotes, "If there is a second wave, a second economy-wide shutdown should be avoided in favor of more targeted approaches that are effective and avoid further erosion of public finances and the risk of hitting debt walls and loss of borrowing capacity." Let me shift then to the economic front. Alberta's deficit, we estimate this year, will be $20 billion. The Honourable Finance Minister will be providing a more detailed update to the Assembly and Albertans in August. And we understand that the national debt is now exceeding $1 trillion. And we must acknowledge that there are very significant social and economic costs to all of this. And that is why we must take, as I say, more focused responses, such as, for example, continuing to step up our testing. And I'm pleased to say that thanks to the good work of people at Alberta Precision Laboratories, Alberta Health Services, we now have a capacity to process about 9,000 COVID tests a day, and that is moving in early June to 16,000. And if we get the participation with requisite equipment from private laboratories, like, for example, DynaLife, we believe that Alberta's would be able actually to process perhaps as many as 20,000 tests a day. However, we are on average over the past week only processing, I say only 3,000 a day. That's still the highest per capita in Canada. And that's partly because we are having a difficulty getting enough subjects to come forward for asymptomatic testing. So Albertans need to understand that, and so we're refining our strategy to focus on periodic testing in congregate seniors facilities, including long-term care facilities, and the Minister of Health can provide additional updates on that. We also encourage Albertans to download our world-leading, the Alberta Trace Together app, which was initially modeled in Singapore. Apple and Google will be making revisions to the app to make it more user-friendly, and I'm speaking with all of the other premiers about them potentially replicating this to become the platform for a national tracing app, which can help save lives. And my message to people is, I know that some people, and understandably, they don't want some government thing tracking where they are. That's not what this is. This is only information that's relevant if you come into contact with somebody who's been tested positive for COVID, and it allows for instantaneous automated contact tracing, which allows us to step on outbreaks before they threaten the broader community. If we want to reopen, as we do, Mr. Speaker, then we must do things like this. This is how they've kept the spread so low in jurisdictions like Singapore, while keeping their schools and their economies largely unaffected. Of course, it's also critically important that we have rigorous border screening measures, which is why last week I announced that Alberta has the strongest measures for border screening, including infrared temperature scanners at ports of entry at the Edmonton and Calgary International Airports for international arrivals, as well as at the Coots border crossing. We are requiring individuals to submit their self-isolation plan for 14 days upon arrival. If they do not have a credible plan or support for it, we will provide them with shelter for those 14 days, and we continue to work with the federal government to strengthen those measures. At the same time, I'm challenging our officials and the Prime Minister and other premiers to develop a strategy for ensuring a future for travel, including our tourism industry, In a pandemic environment, like other jurisdictions, Australia, New Zealand, Austria, and Iceland, for example, are implementing. Mr. Speaker, perhaps the most important strategy as we move forward is building a wall of defense around the most vulnerable, seniors in particular. And as you know, the government of Alberta has taken extraordinary measures in that respect, including requiring that healthcare aides working in continuing care settings may only work in one facility to prevent the prospective transmission, of course, using PPE, and a number of other protocols which are supported concretely by Alberta's government with the $170 million package of comprehensive supports announced by the Minister of Health last week for congregate senior care facilities. Mr. Speaker, we can learn how to manage outbreaks from countries like Germany. Despite high overall infection and death rates, most of that country moved quickly out of their lockdown, much more like a lockdown than in Alberta, and ahead of Alberta. As I've said from the beginning, we must protect both lives and livelihoods. This includes being increasingly cognizant of the mental and psychological health impacts of lockdowns. And I'd like to inform the Assembly that the government has been tracking non-COVID related health statistics, including for suicides and other morbidities. And Mr. Speaker, at least based on the last data set I saw, we have not seen an increase in the trends of deaths related to non-COVID health challenges. But we are concerned about the mental health impact of all of this, which is why Alberta's government has provided an additional $53 million in support for COVID-related mental health interventions, much of it delivered by community organizations. That is in addition to the $150 million Mental Health and Addictions Action Plan that this government is implementing. Just to put this in context, Alberta's funding for COVID-related mental health support is greater than the packages of all other 9 provinces combined times 2. We are taking the mental health challenge very seriously, and I wanted to commend the Associate Minister for his work and that of his officials in this respect. We, from the very beginning, focused on homeless shelters, Mr. Speaker. I can tell the House that the Emergency Management Cabinet Committee at every meeting has a specific update led by the Honourable Minister of Community and Social Services, and we provided $50 million right out of the gate in mid-March to support nonprofit and civil society organizations with, I think, $25 million set aside for homeless shelters. We provided robust testing support, PPE, funding for overflow capacity, isolation capacity, and I'm pleased to see that we have not seen a single fatality from our homeless population. One thing I think we're learning epidemiologically is that population has a very high level of immune resistance, of immunity and resilience against an influenza of this nature. Mr. Speaker, I'm running out of time, and so I regret that I won't have time to go through in detail the scale of Alberta's enormous fiscal and economic response to the crisis. I will be happy to take questions in this respect, and my colleague, the Honourable Minister of Finance, will be detailing the elements of the $13 billion in pandemic relief and economic stimulus provided by the Government of Alberta through deferrals, liquidity measures, and cash. Mr. Speaker, we want Albertans to know that we will do everything within our means to protect both lives and livelihoods, families and job creators during this time in partnership with other orders of government. Government is developing its economic recovery strategy, which will include truly extraordinary measures to ensure that we come out of this crisis stronger than ever. And that, let me conclude with that, Mr. Speaker. I have confidence in the resilience of the people of Alberta. They have demonstrated that in remarkable ways in recent weeks. I am proud of the people of Alberta for taking on this challenge, for so far defeating this pandemic, and for showing great strength of character, and optimism about the future, an optimism that has always characterized the people in the province of Alberta. Thank you.
Hear, hear.